do some skincare with me while I talk about how I have 2 chronic diseases at the age of 30. So at 17, I was diagnosed with multiple sclerosis. I remember it was the day after my 17th birthday. My cousin was actually at my house, and I woke up and my legs just felt really weird, like heavy and hurting, and I couldn't like stop moving them. Like they hurt really bad. So I went to my mom's bathroom. She was getting ready for work. She worked at a doctor's office, and I told her, what was going on. And I was also having like some like lower abdominal pain. So she took me to work with her, thinking that I maybe had appendicitis or something. So she took me there, and they ordered, I don't remember if it was a CT or an MRI, whatever. They ordered something, and it showed a lesion on my spinal cord. And I just got this. It's Rhode, the peptide glazing fluid, and this is literally like my new favorite thing. Anyway, it showed lesions on my spinal cord, and that was like concerning. So then they also ordered a brain MRI, which also showed lesions. So they referred me to the Cleveland Clinic. I also just got these Rhode, the peptide eye depuffing patches. So we're gonna try them if I can get them open. Hold on. So they referred me to the Cleveland Clinic, and I went up there and I seen a doctor. Her name was Dr. Rensel. I really, really like her. I did go up there a couple of times, but she started me on an injection for treatment of multiple sclerosis because she also did like blood work and all the neurology tests and MRIs and stuff, and came back. I've got 3 or 4 lesions on my spine and 2 or 3 on my frontal lobe of my brain. So she started me on Copaxone. It was an injection that I had to take, and I was 17. So I was giving myself injections, and I remember we went back for the follow-up. It was like 6 months later or something, and she asked how everything was going, and I was like, I don't really like giving myself shots. So then she started me on Tecfidera, and I still am taking the Tecfidera actually, and it works really well for me. I haven't had any relapses, thankfully, since I was 17, and I'm 30 now. But she was like that she would start me on the pill instead of the shot. So even after I had like my daughter, I had to quit taking my medicine the whole time I was pregnant with my daughter, and that was really actually scary. But I didn't have any relapses then either, and then I started it back as soon as I had her, and luckily that was okay. And then for my second one, literally was just diagnosed like last month with this. So back in November, I started having like really short periods, and that wasn't normal for me. And they would be like random. Normally my period's right on. It starts like at the same time every month, and it lasts the same amount of time, and it's just normal. Well, in November, I started having like weird symptoms and stuff. So I went to the doctor, and she did a ultrasound and then ordered a CT. And it didn't show anything. So then I actually just had a laparoscopy last month, and it showed deep infiltrating endometriosis. So I was hoping that the surgery, they removed like 70% of it. She said they couldn't get it all because it was on my bladder and my ureter and a ligament down there. Anyway, well, here we are, like literally a month since I had that, and I'm already having symptoms again. So I'm not really sure what to do about that because there isn't really a medicine for it, and I'm not really sure like what you're supposed to do if you're still having symptoms besides like a hysterectomy. And I'm kind of scared of that because I don't want like the hormonal problems that come along with that. So if you have any advice on what's coming off, endometriosis, like treatments or what's helped you, please let me know.